for joining us here today. Thank you.
Thank you. Good afternoon, everyone. I'm speaking to you from Jalalabad in eastern Afghanistan, where it's been 1 week since the 6.0 magnitude earthquake struck this region, followed by a series of aftershocks over the past days, ranging from 5.2 to 5.6 in magnitude. I've been here on the ground for the last 5 days, visiting the most impacted areas and engaging with affected communities, including a trip to the earthquake's epicenter on a UN interagency road mission on Friday. We traveled to the WFP hub that's being established in Mazar Dara and Nurgal district of Kunar Province to provide key response enablers for scaling up, including an UNHAS helicopter to ensure humanitarians and supplies can reach these areas. These areas are some of the most remote rural areas of the country. Even before the earthquake, these villages were difficult to reach. Now, with the earthquake, it takes extraordinary effort to get there. Our trip from Jalalabad of roughly 100 kilometers or 60 miles required more than 6.5 hours. The only road in and out is a narrow single-lane track carved into the mountainside. During our mission, the road was blocked by large rocks from landslides and many vehicles trying to get up and down the valley, including large trucks overloaded with humanitarian assistance rushing to get to the most affected areas. As we drove towards the epicenter, we saw families walking in the opposite direction, displaced, carrying what little they could. Many were still wearing the same clothes from the night of the earthquake. Mothers and fathers were carrying their children, some with fresh bandages covering their injuries. The devastation only got worse as we got closer. Entire villages had been destroyed. Search and rescue operations in the area had been concluded by Friday. However, when we reached Mazar Dara, the smell of dead animals from the surrounding villages was overwhelming. We saw families whose lives had been shattered just within a few minutes. The earthquake had destroyed their homes, their farms, and their livelihoods, leaving them with absolutely nothing. The conditions on the ground there are dire. Some families are living in crowded tents, while many are sleeping under the open skies, exposed to rain and cold. There was no clean drinking water and no sanitation. With cholera endemic in the region and initial assessments indicating that 92% of these communities are practicing open defecation, the potential for a cholera outbreak is alarming. Scaling up WASH assistance, including clean water, soap, and latrines, is a top priority to prevent the worst outcomes. Today, I visited 3 IDP sites in Kunar district, meeting with affected communities and spending most of the day speaking with women and girls. Overall, the affected communities are struggling with basic survival. They urgently need water, tents, and food. Women in particular emphasize their need for water and adequate clothing, both for themselves and their children. These communities are devastated. Everyone I spoke with had lost multiple family members. Most of them are deeply traumatized and in need of psychosocial support. We also observed many malnourished mothers and young children. While nutrition screening and treatment services are ongoing in some sites, this needs to be urgently scaled up. In Afghanistan in recent years, women and girls have been pushed to the very margins of society and survival. We know from previous earthquakes and other crises that women and girls always bear the heaviest burden. This is why their needs must be central to our humanitarian response. The teams on the ground have been racing to the affected areas with assistance as fast as the difficult road conditions will allow, and the needs are overwhelming. OCHA is on the ground closely working with all humanitarian partners and engaging with communities to ensure that assistance reaches the most vulnerable, including women and girls. But time is running out. Any day, rainfall could cause flash floods in the valleys where the IDP sites have been established. Additional aftershocks could cause more severe landslides, cutting off access to communities still living near the epicenter. Also, at the end of October, the winter season will begin, and snow will cut off access to these mountain valleys. If we don't act now, these communities may not survive the coming winter. Additional funding is urgently needed. Without immediate support, the weeks ahead risk compounding this tragedy with preventable disease outbreaks, further displacement, and additional loss of life. While additional international support is coming in, flexibility and speed are critical. A response plan is being finalized and will be launched tomorrow to cover immediate life-saving needs. The Emergency Relief Coordinator has already released $5 million from the SURF, and the Afghanistan Humanitarian Fund will complement this with an allocation of another $5 million, but the scale of the devastation demands much, much more. Communities are asking for our collective support, not only to survive today, but to have the strength to rebuild their lives tomorrow. Thank you very much for the opportunity to speak with you today, and over to you in New York.
Thank you so much, Shannon O'Hara. Edie, please go ahead.
Thank you very much on behalf of the United Nations Correspondents Association for doing this briefing. My name is Edith Lederer from the Associated Press. I have a couple of follow-up questions. First, you said that a number of villages have been destroyed. Is there actually any number of how many villages and how many people are displaced? And secondly, can you tell us what kind of cooperation you've gotten from the Taliban in the search and rescue and immediate aftermath issues related to the quake? And thirdly, there have been reports that when the rescue teams came in, that men and some children, males, got rescued and that women and girls got left behind. Can you confirm that that's happened, and has it been reversed by now? Thank you.
Please go ahead, Shannon.
Thank you so much for these questions. In terms of the number of villages that have been destroyed and the number of families that have been displaced, assessments are ongoing. So we've been trying to reach the most affected areas with assessment teams first. That being said, out of the 411 villages that have been affected by the earthquake, we've only been able to assess 49 at this point. Based on initial assessments, though, we can say that, and these numbers are the numbers from the assessment teams, that we have approximately, sorry, I'm getting the latest numbers from the assessment, 5,230 homes are destroyed and 672 are damaged in Laghman Province. Yes, overall, sorry about that. In terms of cooperation with the authorities, humanitarian coordination and partners report an enabling environment that's provided by the de facto authorities without major obstruction of humanitarian operations. The DFA, or the de facto authorities, have mostly led on search and rescue operations and road clearing with heavy machinery. And today, ANDMA, the Afghanistan National Disaster Management Authority, announced an end to its search and rescue operations. In terms of the reports of issues with the search and rescue operations, the women and that I've spoken to in my 5 days here have not reported any incidents to me that they were aware of. So I cannot confirm or deny these reports.
Just a quick follow-up. You said that 49 villages out of 411 have been assessed. Is the fact that so many have not been assessed a result of the difficulties in getting to them, or are there some other issues?
No, the issue is really the road conditions and the rural and remote locations. So as I mentioned earlier, it took us 6.5 hours to reach one location, which takes an entire team 1 day to get there and get back. So it's really hindering how fast we can assess these areas. And we're trying to increase the number of teams and do so as quickly as possible.
Thanks, Marian. Please go.
Hi, thank you so much for this briefing and the latest updates. This is Mariam Ramadi with Afghanistan International. What is being done for vulnerable groups such as women, children, and disabled who are right now affected in the areas that you described? And also the second question, I know you're facing budget issues and you're asking the member states to give more money to the places that are needed. But how can OCHA reassure these member states that these money will go to the people who are affected and the Taliban are not going to use the aid? Because that happened before and some states are worried that this money will not, at least all of it will go to the people who are most affected after the earthquake. Thank you.
Thanks so much. In terms of reaching the most vulnerable populations, the key is the assessments. So when our teams are on the ground, they are assessing these families and understanding who are the most vulnerable households. And they prioritize female-headed households, households with members that have a disability, and others that are in urgent need of assistance. So in terms of also we're ensuring that women are represented in health teams and more women aid workers are supporting distributions along with nutrition, psychosocial, and other counseling services to increase the number of women that are participating in the humanitarian response. However, due to these remote areas and difficult journeys, including journeys by foot, so often teams will have to drive 6 hours and then walk 2 to 3 hours by foot. Fewer women were joining in the initial response efforts, but partners are increasing the number of women staff sent to these affected areas.
Thanks.
Thank you.
Also my second question, please.
Can you repeat your
Sorry. Go ahead.
Yeah, I was asking, how can you ensure that the member states who are sending more money to OCHA or to UN offices in Afghanistan, how can you ensure them that this money will go directly to people who are mostly affected? Also, part of your, another follow-up regarding your response to my first question, today the Taliban didn't even let the UN employees, women employees, to enter UNHAS office in Kabul. In these rural areas, the rules and restrictions are even worse. You said women are mostly, you're trying to get women to distribute the aid and help people. I'm sure there are more restricted areas in terms of women being helped or women helping other people. How are you dealing with that?
In terms of your second question, so the funding that's provided is provided to humanitarian partners, and it goes to the UN and to those partners. It's channeled to them and not to the DFA, to the de facto authorities. In terms of access to women, I've been in the field now for the last 5 days, and I have yet to hear from women that they're not being reached with assistance. These are conservative areas, more conservative, and there are nuances and variations between communities. Some communities are more conservative than others, but women aid workers are able to engage with these communities and understand what their needs are and ensure that assistance is reaching them. Thank you.
Thanks. Pan, and after.
Thank you, Shannon. And you've sort of answered the question, but if I can double down a little on both Edie and Mariam's question, there were reports from the ground that because of the Taliban rules of unrelated men and women weren't being pulled out of the rubble, women weren't being helped. Your answer in many ways is that women are being sent to the front lines to resolve this. What is the workaround that OCHA is doing to make sure women may not be reporting it to you, but it's happening at the rescue sites? What is OCHA doing to be able to resolve that, and how many women are being sent as aid workers? Thanks.
You'll have to forgive me because the connection was bad. I did not hear the first part of your question. If you could repeat it.
It's a similar one to Edie and Mariam, which was follow-up on what is OCHA able to do to work around the restrictions of the Taliban on unrelated men and women, and we've seen reports from the ground about women not being pulled out of the rubble because of this. How do you solve it? How many women are being sent in the aid capacity? Thank you.
So we don't have the exact figures. The numbers are constantly changing. And as I noted, we're making concerted efforts to scale up the number of female humanitarian aid workers that are involved in this response. What I can say and what I can speak to is that in every site that I've visited over the last 5 days and in all of my missions, national Afghan women have been present as humanitarian staff and have actively participated and engaged in the response. Thank you.
Abdelhamid, please.
Thank you, Shannon. Abdelhamid Sayam from the Arabic Daily, Al-Quds Al-Arabi. I have two questions. First, are there any rescue teams arriving from the neighboring countries like Pakistan, China, maybe Russia, or any other country? And the second, have you noticed any kind of volunteers coming from the Afghani people to help rescue the victims? Thank you.
Thank you. We are not aware of any rescue teams that were sent in from other countries. We are aware of bilateral humanitarian assistance that's been sent from multiple locations, including neighboring countries, to help support these efforts. And yes, to confirm, Afghan local charities are leading on some of this response. They're providing hot meals in IDP sites. They're helping displaced families in local communities, and they're helping to support their neighbors that have been displaced. Yes.
Thanks. I'm just going to move online. If the car, you have a question?
Thank you. My question has been just asked by Abdul Hamid. Thank you very much.
Thank you so much. Do we have any further questions in the room? No? So I just want to thank again our guest, Shannon O'Hara. She's the head of strategy and coordination for OCHA in Afghanistan. She was briefing us from Jalalabad. Thank you so much for bringing